Chris
Thank
is
you
on.
again.
Chris is on vacation.
All right,
Yeah,
getting ready
Chris is
for
fine. He's okay. He's just on vacation.
right, getting ready for Christmas. All right. Thank you for this opportunity to share with you where we are with our COVID census in the House as of this morning. 22 individuals. That's the lowest we've seen in a while. And hopefully we continue that downward trend. It's the reflection that the community hopefully is heeding to the precautionary measures and just being good citizens to then help us all get this COVID under control. So
Yeah,
it's a
and
good sign.
Lillian, we've seen a lot in the news here and everywhere about that possible Thanksgiving surge, people gathering. Would we be seeing that already, or is that window kind of creeping up on us, or where are we at with that?
That's my expectation, that we would have already been seeing some numbers increase. We do have some individuals who still come into the emergency room who test positive, but their conditions are not severe enough to warrant hospitalization. So, but yes, you're absolutely right, Andy. We would have been seeing, but again, we don't want to let our guards down. We
No,
still
not at
want
all.
to be right, exactly.
Right.
So of the 22 who are in the house, 8 of them are requiring ICU level of care. And of the 8, 4 of them are on ventilator support. So again, it's hopefully a good sign. On the non-COVID side, though, we continue to see, increase of individuals who are really ill. We had 8 non-COVID ICU patients. And so, we're still, it is on the non-COVID side, people still needing hospital care. And so we're accommodating those individuals in the hospital. And so that's where we stand with our census in the House.
What about the Bam Lam? I always have a problem with that. Bamlani Vivob.
Right, there you go, you got it. At last report, there were 10 individuals who received the antibody therapeutics. I was asking for an update and I haven't gotten a response. So normally in the infection control chat group, I get an update of people getting it, but everybody's kind of distracted with doing other things. So as soon as I get that update this morning, I'll let you know. But as of last week, Friday, there were 10 individuals who received it.
All right. And convalescent plasma?
7 individuals were given the convalescent, and a couple of them received more than 1 unit.
Okay.
But 7 individuals received the convalescent.
And as far as you know, there's been no issues or problems?
Right.
Okay.
No reports of adverse events or adverse reactions.
Any update on the SIF?
Still 0 patients there, and we're still standing it down. We're just waiting now for the contractor to present to us the design for how the construction is going to be to split up back.
All right. I know I really hate asking this, but has there been any deaths overnight over at GMH?
Not through the night. There was one yesterday. That was the last one that we know of, but not through the night. There weren't any. Knock on wood, nobody else will, lose the battle to this COVID. So.
Well, we just heard from the governor's communications director, Crystal Paco San Augustine. There's going to be a major announcement coming out of Guadalupe today about the further easing of restrictions. And so I guess we can end it with just your message to the community, that we all have to continue to do our due diligence.
Right. I mean, even though there is that, I guess, easing up of the restrictions in preparation for, celebrating Christmas, we still need to exercise the caution, wearing masks, social distancing, minimizing, the congregation as much as possible, but still enjoy the spirit of the Christmas, with families and with friends. Continue to just wear the mask and social distance.
And
I did want to ask you, Lillian, I know everyone on island, we cannot thank the healthcare providers enough, the nurses, the doctors, you, the administrators, everyone over there that's keeping GMH running. But I mean, that's a debt that we just can't really voice, you know, how deeply grateful we are. But I wanted to ask, how's the morale over there as far as the nurses, the doctors that are seeing this play out like as frontline as possible? How are the spirits?
Well, the spirits are good. They are tired and, you know, they are burning out, but what's helping out are the numbers are dropping. And so there's a little bit of some, you know, breathing and some, you know, okay, we're not going to be so stressed with having to care for all these many number of COVID patients, but, you know, the numbers are going down, so it's helping. And, you know, yes, I certainly appreciate your sentiments that, you know, the appreciation and the recognition of the hard work of the healthcare workers throughout the whole hospital. It's not just the doctors and not just the nurses. There's the housekeeping people, the dietary, the, you know, patient registration staff, the whole hospital, the team here. And, you know, what they do, it's priceless. You know, you can't really put a dollar figure to it because they're risking their lives coming. I mean, even some people don't even want to come to the hospital because they're afraid of the COVID. You know, the mailman doesn't want to deliver our mail to us. You know, yeah, I mean, and that's understandable, but, you know, if we just, you know, provide them with more information and more training and the assurance and the confidence that, you know, you can prevent getting the COVID infection. Mm-hmm. And so, but yes, you know, we're all tired, but we keep pressing on because we want to make sure we get through this, and we will. We can get through it. We will.
Mm-hmm. And you, speaking of prevention, you guys are getting ready for the vaccination, right?
Yes, it's exciting. I'm excited. I'm looking forward to it. We just had a webinar at 5 this morning with CDC, and you know, it really is assuring and comforting to hear that it is very effective. You have to have the 2 series of the doses there of the vaccine. You can't just get one. You have to have both series, and so it's safe. It's very safe, and so I'm looking forward to getting the vaccine. Myself.
So there's light at the end of the tunnel, but this is not a time to relax and say, oh, we're all in the clear. We still need to be vigilant.
Right. We still need to be vigilant. Exactly.
And what about, we've heard all about the, you know, it has to be kept at a certain temperature. And how is the infrastructure there at GMH? Are you readily equipped to handle all that?
We have the freezer. We have the freezer that has that capacity. And we're monitoring and logging the temperature. And so once it arrives on island, public health will receive it. And so we will get what allocation they're going to give us to the hospital, or we will store some of it in this freezer. And so once we're ready to roll out to administer the vaccine, we will have different pods within the hospital so that we can then make sure we get as many of the healthcare workers in the hospital vaccinated, of course, respecting those who don't want to get it right now. Okay. And so, because, you know, it's not mandatory, it's an option. It's being offered to people so as a way to protect themselves and to, you know, to really fight this COVID. And so it's available once we get it on island. And so we will administer it throughout the hospital for those who are willing to take it.
And before we let you go, Lillian, you know, I've seen the pictures. I haven't had a chance to go out there, but you guys got a pretty awesome display outside of the hospital.
I was just up there yesterday and I saw the display. It looks like, remember how Skinner Plaza, when they did all the lights and decorations around the holidays? That's what it looks like. It's beautiful. I thought there was a bunch of people just standing in the courtyard there, but it's actually statues that they have. I was like, why are these people? Oh, okay. It looks great.
It is, and it's really a great appreciation to the Pink Ladies, the Volunteers Association. They were the ones who donated all of that, and, you know, just to lift the spirit of our employees, you know, and, you know, people who come here, because it is the Christmas season. Yeah. We still can have some joy, you know, despite all this, we still can have some joy, and there is hope. there is hope and there is light at the end of the tunnel. And so the Volunteers Association procured all those decorations, and it was our FM guys, the team that put it up and secured them. So yes, it's a beautiful display.
And just so people who are hearing about it, this isn't for people to go and congregate, right? just drive by and you can look at it.
No, we don't want to come and congregate, but just to enjoy the beauty of it.
All right. Thanks a lot, Lillian.
Thank you too. Take
All
care.
right. You take care. All right.
Alrighty, bye-bye.
Bye. All right. That was Lillian Posadas. Earlier we had the governor's spokesperson or communications director. What was that, Andy?
So nice. It really does. It reminded me of the old Skinner Plaza days when they would have the Christmas festival and the lights down there. It looks great. But like you said, don't go hang out, don't go congregating there. Bring your family. If you want to kind of drive by and take a look at the lights at nighttime, I highly recommend it. And I think it's good for patients at GMH, the nurses, the doctors, to be able to